on 104.2 FM in Ramsgate, Whitstable and Deal.
And across West Kent on 96.7 FM. This is BBC Radio Kent.
Turning now, though, to the issue of politics in all of this and care homes as well. So Boris Johnson and Sir Keir Starmer clashed in the Commons. I don't know if you heard it yesterday. It was over the government's plans for a trace and track system to control outbreaks of coronavirus. The Prime Minister said he was confident it would all be working by the 1st of June. It's one of the pillars, if you like, and we were talking about it, weren't we, with Phil Clark from the Teaching Union, saying that's what they'd like to see in place before schools go back. And there's been a lot of criticism, actually, about not enough testing going on in care homes. And managers at a Thanet care home have revealed that 18 of their residents died in the last 2 months. Staff at the Grosvenor Court care home in Cliftonville near Margate say that at the peak of the pandemic, they were up to 3 deaths a day. But still, they had to fight to get residents tested, and then they had to wait weeks for the result to come back. Now, we did ask to talk to the Department of Health about all of this, but they declined our offer this morning. We can, though, talk to Karen Constantine, the Labour Party Kent County Councillor in Thanet. Karen, thank you for being with us this morning. Devastating news. I mean, have care homes been let down in all of this?
Yeah, I mean, thanks for having me on this morning. There's such a lot to talk about.
Yeah.
And yes, it's absolutely devastating what's happened in Grosvenor Court. And of course, my thoughts and I'm sure most people's thoughts are with the people that have lost loved ones there and with the staff, because it's incredibly, incredibly stressful. I just can't imagine. However, we did know well in advance at the start of this crisis that care homes were going to be a very difficult area and that elderly people were going to be vulnerable. And we also knew that the care home environment was an environment that could help a virus to spread with the venting systems that are often in place, with the narrow corridors, with the fact that staff often work in more than one location. And the fact that we didn't test our elderly people, the fact that we sent them out of hospital with COVID-19 into these care homes, we set this up, basically. And I think if it shows one thing, it shows that our care home system, which has evolved but completely accidentally, now needs to be reformed. It needs to be nationalised. We need to have proper standards in place. We need to have proper performance management. We need decent pay. And we need to really start to think about taking out the profit element and actually looking after our elders properly and with dignity.
Yeah, it's a huge issue.
Got to come out. It's got to come out of this. We've got to have some positives. We've got to have some wins out of this dreadful situation.
Absolutely. I mean, Matt Hancock does talk about putting a protective ring, doesn't he, around our care homes. He talks about the fact that 2/3 of them have remained safe throughout all of this. But it's difficult, isn't it? I mean, do you have some sympathy with the government putting the NHS first?
The NHS has to come first. I mean, at the beginning of this crisis, we needed every single bed for every single ventilator. And obviously we needed to protect staff. And those NHS staff now, and I'll be clapping for them later, they have been overwhelmed. They have been overworked. They are now absolutely exhausted. But the same can be said for lots of workers in the public sector, so DWP workers, etc.
Yeah.
This crisis has caused an immense amount of work for people. And the way things are going, and this is what's really important, it doesn't look like there's going to be any let-up. There's going to be no slipping down a gear. I mean, we're all going to have to be vigilant. And people that are working to keep us safe are going to be continuing to work at 100% rates to keep us all safe.
Yeah. And on that point of keeping us all safe, we have sort of alluded to the fact that Boris Johnson is confident a trace and tracking system and testing will be in place by the 1st of June. Are you confident that that can happen? And how important is that?
I think it's incredibly important. I think it's actually important to do the trace and track so that we can control the virus, and we can do that really quickly. And actually, on the 11th of February this year, when we had Boris Johnson telling us to wash our hands when the rest of Europe was going into lockdown, if we'd have started this then, we might be further ahead now, because we have suffered a really huge amount of deaths here. And it's very difficult, I know. I completely understand that you can't compare one country with another country very easily. But we are now in some real difficulties, not just with our healthcare system, but also with our economy. And this government has dropped the ball, in my opinion. It's dropped the ball a lot. You know, that initial briefing on the 11th of February, that was very poor. You've now got the NHS Confederation that have come out and said the track and trace system, the app must be in place before schools are allowed to go back. And actually, we're doing everything. If you were, there seems to be a lack of planning. There seems to be a lack of clear strategy. There actually seems to be a lack of leadership, I'm afraid.
You mentioned schools there and schools going back. It's one of the other things we're discussing this morning. What do you think about that one? I mean, there's obviously a push and pull of arguments both ways.
Yes, and as a counsellor, I've been contacted by people that have got children that are vulnerable and they need some extra help and support. And it's very important to give that. And in some cases, that can be given on an almost one-to-one basis. I've got parents that have got children at home, and the homeschooling aspect is very difficult. But I've raised children myself; they're all grown up now. I know that kids are incredibly resilient, and they learn at different rates at different times. In any case, so as a nation, we could have an ambition to help them all catch up at some point in the future. It doesn't all have to be done right now. A little bit of home learning is great, but let's not, make it really difficult for parents and children, because I wasn't a natural teacher as a parent, I can tell you. And what we saw in France, we saw children going back. A third of the school children were sent back, and then they had a flurry of COVID cases. That's not what we want here. No. And I read a report overnight which said something like 81% of parents are not thinking of sending their children back. So that kind of underlines the fact that there perhaps isn't confidence. And watching children, nursery-age children and reception children at play, I mean, the idea of trying to get them to observe any social distance it's impossible. They can't do it.
It is. On that point, Karen, as you say, there is a lot to talk about at the moment. Please come and talk to us again soon, and we can, keep in touch with us here at the Wake Up Call. That's Karen Constantine, the Labour Party Kent County Councillor in Thanet. We talked about care homes, testing, tracking, tracing, and schools, of course, as well. As I mentioned, we did want to talk to the Department of Health about care homes, but they weren't available at this time.